Good morning, respected faculty members and colleagues. It's my privilege to welcome you all at the Department of Medicine, Christian Medical College Fellow. We are especially honored to welcome the family of Dr. Mary Kane, who have generously instituted the Dr. Mary Kane Award, especially Dr. Madhuri Kirloskar, daughter of Dr. Mary Kane and Professor of Medicine. Today, we gather to celebrate Dr. C.K. Eapen, who has been awarded the Dr. Mary Kane Award for the year 2025, one of the department's most cherished honors. The Dr. Mary Kane Award commemorates the life and legacy of Dr. Mary Kane, whose deep compassion, humility, clinical acumen, and devotion to her patients and students left an enduring mark on this institution. Each year, this award recognizes a faculty member who embodies the same qualities of excellence, humility, and service. This is the third year of this award. The first and second awards were presented to Dr. Glory Alexander in Bangalore and Dr. Marcia Warren in Ahmednagar for their pioneering work in contributions to HIV/AIDS care and prevention. Before we invite our speaker, let us take a moment to view a short video presentation that reflects the spirit and ethos of the Mary Kane Award and its significance in the life of our department.
Hello everyone, I am Dr. Madhuri Kirloskar with my sisters Dr. Rohini Divedi and architect Nandini Bisk and our respective families are thrilled to witness the establishment of an award in our mother's name honoring a truly deserving individual. The idea of initiating this award came to us, her daughters, as we reflected on the essence of our mother's life. She was the epitome of simple living and high thinking. We stumbled upon this treasure trove of certificates bearing her exceptional academic accomplishments, such as winning multiple gold medals and prizes in various subjects at undergraduate level, being the best outgoing student of a batch of 1943, as also the first MD in medicine from this prestigious institution. We felt that her remarkable life should be commemorated and celebrated for generations and years to come, despite her very modest and humble nature. We took this initiative during my visit to CMC Vellore for Alumni Day in 2022, and this gained momentum with the unwavering support of the entire team at CMC. My cousin, Dr. Rabin Chako, the principal, the vice principal, the head of Department of Medicine, the senior, very well respected doyen, Dr. Zakaria, and his son, Dr. Anand, all gave us invaluable guidance at every step of the way to establishing this award in her honor. The family of Dr. Mary Kane is forever indebted to the prize committee for the impartial selection of the right candidate, as well as eternally grateful to all of us who assisted in following proper institutional protocols. This award is intended for a deserving MD candidate who has directed their efforts towards addressing societal needs and serving as a guiding light to the residents and the undergraduates. This will help others to carry forward the torch that Dr. Ida Scudder lit on these very sacred grounds, and which inspired people like Dr. Mary Kane and the recipient of the award to embody the spirit and the ethos of this premier institution.
Thank you. As we have seen, the Dr. Mary Kane Award stands as a tribute to a lifetime of clinical service and faithful excellence, qualities embodied by this year's awardee, Dr. C.K. Eapen. To introduce Dr. Eapen more formally, I now invite Dr. Soumya Satyendra, Professor of Medicine, to kindly introduce our distinguished awardee and speaker.
Thank you, Namrata, and thank you, Dr. Anand. Um, it's my privilege to introduce Dr. C.K. Eapen. So you may not remember, but I introduced you as a postgraduate when we did our golden anniversary of the Department of Medicine. I was a final year PG, and I happened to introduce you then also. Of course, then I tried to make some funny jokes, which may not have seemed so funny then. But now it's my privilege to introduce you properly. And as a recipient of the 2025 Mary Kane Award, it's my privilege to say that Sir embodies CMC's mission statement. I'll just read it out, though we all know it, is to develop through education and training, compassionate, professionally excellent, ethically sound individuals who will go out as servant leaders of health teams and healing communities. This is the first part of the mission statement. And that's what Dr. C.K. Eapen has done. Just like Namrata was talking about Dr. Mary Kane being the epitome, we are presenting another epitome today. So, sir, after completing his postgraduate training in CMC, he's dedicated over 50 years in two mission hospitals in Kerala. Little Flower Hospital in Angamali and Malankara Medical Mission Hospital in Kolancheri. He's been a leader in both of them, not just holding posts, but also developing in Kolancheri a medical college, helping to develop a medical college with 1,100 inpatient beds. Why would I say professionally excellent? I think Sir has a curiosity which is genetic, which we see in our Dr. Eapen also, because he was curious about acute kidney injury in snake bites. So he first thought of serving the patients. So he came here to the dialysis unit, which was just created at that time to train so that he could treat the kidney injury in snake bite patients. But that didn't stop him. He went on to identify how pituitary apoplexy happens in these patients and published it, and which went on to be a guideline in the Government of India standard treatment guidelines of snakebite management. This was in 2016. Sir then moved on to Kolancheri, and there I think now he wasn't satisfied with just knowing what snakes did. He went on to check what happened with leptospirosis and did a lot of work which contributed to the diagnosis and epidemiology of leptospirosis and worked with the people who were in CMC. Sir has also been an important part of the CMC community. He was serving in the council, representing the Malankara Orthodox Syrian Church and in the CMC Fellow Association. Now, Sir's Dr. C.K. Eapen's intellectual curiosity and impact on patients' lives is very evident. And Sir will also share his experiences, and we will know why we as a department thought it only apt to give Sir this year's Mary Kane Award. On a personal note, remember Dr. Madhuri talked about simple living, high thinking. If you see Sir's uniform today, Sir's wearing a white shirt and white trousers, and that's how most of my teachers were dressed throughout their CMC journey. And I think it was traditional that we wore white. And the colors have only come in now. All the back rows are full of colors. But I was just saying that I'm looking at Sir now and I can see some things have not changed. And it's so we go on to just see how Dr. C.K. Eapen's life was similar to Dr. Mari Kane, as mentioned by her daughter, the very first postgraduate alumnus who worked for the healthcare of mill owners in Bombay. I think you see lives where you identify health needs wherever you are, and then you work towards addressing them. If you solve them, then you find the next health need. And that's how we can make an impact. So it's my privilege to invite Sir to give this year's lecture towards the Mary Kane Award and to share what he has done to exemplify our motto, not to be served, but to serve. Dr. C.K. Eapen, please do come and share your experiences.
Good morning, everybody. I'd first like to thank the Department of Medicine for having invited me to speak today. And chairing today's session is Dr. Anand Sakriya, because Dr. Samuel George has gone off to Ceylon. I don't know for what. And he was the one who was asking me to come around here. And I would like to thank Anand Sakriya for more reasons than one. After my undergraduation in Madras Medical College, I came to CMC Vellore and was here from 1960 to 1966. I could still remember Dr. Kudumbaya taking us to clinical sessions, bedside clinic, the way he argues out from the symptoms with a few investigations, reaching a diagnosis of autoimmune disease, eliminating each one in order. It was something which was, I still can't forget. I remember the other teachers there. We had Dr. Pikoshi, Dr. Narielwala, all of them different ways. Dr. Selvin Baker, then T.S. Koshi, and in cardiology was Professor Vaithalingam, George Cherian, and Sukumaran. I still remember Dr. Vaithalingam, Professor Vaithalingam in M ward on the corridor. She wanted to pull my leg. He said, "Hey, you failed in one subject and got seat for MD." I smiled. "Madam, there are 3 seats, only 2 applicants, only one fellow turned up. You can't chase that guy off, no?" She smiled, said, "Ayyo." But when I went for my second MD exams only once a year. After Dr. Mary, nobody had passed the exam except George Cherian. And so everybody would pass out, go on for MRCP, which is simpler to get, and more definitely you can get. Here you write one, wait for a year, and then you don't know what's happening. But when I went for my MD exam, second attempt, after 1 year going again, and not sure whether they're going to get it or not, Professor Vaithalingam was one of the examiners. Her co-examiner was somebody from Maharashtra. And somehow he knew that I'm from Vellore and must be Vaithalingam's student. She was very partial to me, and I think it's because of Dr. Vaithalingam I managed to get through the exams. After leaving Vellore, opened up into a small town hospital, Little Flower Hospital, with about 60 beds. And financially not very successful. But a month after joining Little Flower Hospital, the director of the hospital came to me and said, "We have lots of difficulty for the finances. In spite of that, if a poor patient comes to you with snake bite, treat him. Forget about the cost. Antivenom, blood, IV fluids, testing, anything the hospital can, you go ahead. The hospital will clear the bill. If it can't be done, I'm also the priest of the local parish. I'll bring it from there. If it's still not enough, my parents, my family in Parur is fairly rich, and I can ask for their help." I said, "Is this man serious about this whole affair? How can he even treatment this?" Looking at him, I knew he was telling it from the bottom of his heart. He must have seen many patients dying, families were suffering because of it, and here's something he can do for it. Must have been his dream. Doesn't it click with what CMC stands for? To minister and not to be ministered unto. After 22 years, a number of patients have gone through, but those who did not clear the bill was only a handful, because the others would somehow make money and clear the bill, or at least part of the bill, only leaving some without it. With his dreams, his blessings and prayers, and the constant support of this director, I jumped into snake bite treatment. I had studied in Madras Medical and then in Vellore, but I had never seen a snake bite case and never treated one. I had no idea what this is all about. And so what Vellore said is, go around, start reading your books, ask other people who are treated. And I went to somebody there who used to treat patients with 6 vials of antivenom. He was a priest. His daughter was a BSc student here, and she had taught him this much. So 6 is the thing, no more, no less. And there was another place where he gave only 2 vials. I don't know where they were trained from. And I went also to Vesha Vaidya, an old lady in Irinyalakuda. And she said, what the hell are you doing here? MD medicine coming to me. I said, ma'am, I just want to see how you handle snake bites. And she shared quite a bit of the things. And one was even putting chili powder into the eye, which later on, she said, I can't spend more time because I'm going for the pilgrimage. When I come back from the pilgrimage, we'll have more. Unfortunately, he did not come back because she died en route, or I don't know where exactly, in the Himalayas. Anyway, the chili powder in the eye is to keep the patient awake. Don't let the snake bite patient go to sleep, because if you let him go to sleep, he wouldn't be able to follow. So it's preferable not to make the patient lie down on the bed, sit on the chair or sit on the bed and fight with anybody, fight with the neighbor or whatever it is. Politics, anything, keep him awake. But if he starts drooping eyelids, that could be the beginning of the cobra bites effect. Lots of anecdotes go through my mind. I wanted to talk of many of them, but my son, no, you have only so many minutes. You should cut it short to fill up in that. So he'll excuse me for that. You got to obey what your son says, no? The cobra bite kills a patient very fast. And I don't know whether you've seen the paddy fields in Kerala. In the paddy field, you have a small stretch of raised, about 10 inches in width. We call the Varemba. You can walk across that. And they had 3 people who was walking along that late in the evening. The first fellow stamped on a snake. The snake bit him. He walked on. The next fellow, he also got bitten. He walked on. The third fellow, he also got bitten. He also walked along. They had slowly walked up, reached the road, and then came to the hospital. The Australians said, if somebody's bitten by a snake, immediately lie down. Don't move your limb, because it might spread it go up. When the one of ligature had been thrown off, no more ligature, but don't move the limb. How can a man walking in the paddy field do it? So when somebody says something in some other country, it doesn't apply here. We got to adapt it or see what is behind it and then try and follow it. The patient, when they came in, the first fellow there was no envenomation. The second chap was severely envenomated, and the third fellow was only mildly envenomated. And mentioned about a person who was giving only 2 vials of antivenom. And I remember 2 cases which comes to my mind. One was the patient came with drooping eyelids, and they gave 2 venoms, and he was fine. He was lying flat in bed. And he is passing the urine with the urinal. But the next day, he wanted to go to the toilet. So I can walk. So people helped him, walked up to the toilet, the Indian toilet, and then closed himself and sat straining, leg bite. And when he finished, he can't get up. Made a noise. Yo, I can't get up. And so people charged up, lifted him up, and brought him to the hospital. They immediately packed him. He came to the hospital. And of course, it was a cobra bite where the venom had been there, lying very comfortably there because the limbs is not moving. Once he started squatting and straining, it came up. And so we gave more antivenom. He pulled out well. A similar case occurred, but this time it was about 36 hours after the initial therapy. There are claims somewhere that the venom inside the body can get fixed, and no use giving antivenom after so many hours. But from this straight away, you can see, not any experiments, from what I could see straight, that this is number of snake patients coming, the clientele in the hospital improved, the hospital income improved, and we were sort of doing well on it. And by the time Dr. Tony Fernandez in the eye department joined us, and that again boosted our hospital in many more ways than one. And in the Silver Jubilee celebrations of the Madhya Kerala branch of the IMA, I had, as part of the celebrations, got a symposium on snakebite treatment. And the director of health services of Trivandrum came to inaugurate it. It's of importance because the next year, the government of Japan sent 2 Japanese, to study snake bites to Delhi. And he landed up in Trivandrum, and the DHS called up, Ipa, you must help me. These people have come from Japan. I said, sure, sir. 3 days here, he can see the cases. And they landed up there and studied our cases, took down notes. And one man speaks English, the other fellow only shakes his head. And also shared one case of viper bite at that time, just a month before that. There was a patient with viper bite. He had improved his urine, everything is clear, but then clotting is clear. He's very tired. He just can't get up. He's feeling, I couldn't know what's happening. So I referred him to CMC Vellore, and Dr. T.S. Koshi examined him and said, pituitary hypofunction. How and why, don't ask me. And so that was it. I shared it with the Japanese characters. And next year, there was a symposium in international meeting in Japan, Tokyo. And these people said, you scientists, you come, you speak on snakes and on that one with the pituitary. Luckily for me, by the time I had got 2 more, one lady and another gent, and I could speak on 3 patients with Sheehan syndrome after viper bites. Going to the international international meetings like this was very helpful, because that time there was Dr. Reid from Britain who was in the WHO, and followed later on by Professor Worrell. He's from Oxford. And they both were never stingy in supporting, advising, and cooperating, and advising me in many ways in my practice. In that conference in In Tokyo, I remember there was a doctor from Israel. He said he was studying snake bites. You know, they really go into it. He said the mongoose and the snakes fight with each other. And the mongoose has got a higher resistance to being bitten by snakes. And he said, is it in the blood or is it in the tissue? And he said, he found out that it is in the tissue. The mongoose can still be affected by venom, but will need a much higher dose than the usual 0.04 milligram kilogram body weight of the animal. But then he also found out that if a snake bites another snake, that snake doesn't die. So that means the snake has got some resistance to venom of the other snakes. Now, where is that coming from? It was not a tissue. How he did it, I don't know. He sent me a lot of literature, but I couldn't find out. But then he said it's in the blood of the snake with that protective portion is. And you can't get blood in from the snakes. So, but he got Red Indian festival where they kill a lot of snakes. So he went with the vessel, collected the thing, and he found out it's in the blood that protects the other blood. I wonder whether catching the python, you can get enough blood. If some of your students have the mind, that'd be a good subject to work on. Years later, when I was working in Kolancheri, a young man in Moatubura, not Moatubura, sorry, he was found unconscious in the toilet on the first floor. So he was taken to the local hospital there, said he must have fallen, and so they did a scan of the brain, nothing there. But I think he stopped breathing, so he's on a ventilator. And they couldn't find anything, so they referred him. And the neurophysician, he went all over from the head to toe, very thoroughly examined him, and found 2 marks on one finger. So he said, how can 2 marks come on the finger? Could this be related? So he pulled me in also to join in this one. He said it could be a snake bite, and it could be then how on the first floor, how can a snake come there? Anyway, we gave him antivenom, no allergy, gave him 10 units, and neostigmine also along with it. And the intubation tube was removed. And then he says, sir, I was sitting in the toilet. Suddenly there was a cobra there looking like this. And it had bitten him straight. But how did the cobra reach? Then we went out and look. There was a creeper coming up from the ground. The cobra must have come up through the ventilator, come in. So it's very interesting. There are many anecdotes, but part of time, I'd be careful in Little Flower Hospital, just not just snake bites. It was the regular things also. And I came, remember, in one of the old students' meet, I presented 2 cases of anthrax meningitis. Anyone seen or heard anthrax meningitis? In the textbook of medicine, Price was the one at that time. There was a system says, if you have a meningitis and if it contains blood, not traumatic, it's anthrax meningitis. Whatever you treat, the patient is dead. Classic descriptions and classic approach. But then by the next year, the next edition of Price, no such description because anthrax is not there in Europe at that, or not so much there. But I happened to get 2 cases and I presented the clinical meeting here a long time back. You see, when you go to a small place, there's a lot of community with certain beliefs. And one of the beliefs is that if a patient wants blood, you buy it. And so who gives the blood? Addicts or somebody who is not well, who just wants alcohol and not good blood. So why not you give? And the community, different ways. One is, if you give one bottle of blood, we will give you so many free. And over 2-3 years, that approach changed, and we could make them donate blood, change in the community's attitudes. Viper bites, but if you end up with renal failure and renal shutdown. And what do we do? At that time, there was one ex-MD from here, Thomas Kurula in Tiruvalla. He had one of the most primitive dialysis units, one basin full, and inside you have a coil, and that is connected to the patient's blood. And this solution, you must have a negative pressure. You have a pipe which goes down 2 floors and opens there, and that gives the negative pressure. It works. But the point is, sending the patient there, taking maybe poor ambulances and poorer roads, the patients get shaken up. And some of the patients, by the time they reach there, they started dialysis, started diuresis. And then in 2 days' time, he sends me, "Ipa, your patient is being sent back to you." I did nothing. I think the roads helped him get over his dialysis. But then he did manage to look after so many patients who had otherwise died with a very primitive dialysis unit. But then Century 1 and Century 2 dialysis units came across, and with our hospital started a dialysis unit for snake bites. I came to here to study, but here at that time, they were using multiple patients being connected to one central tank, and that was not what I was planning there. So I went to Perambur Railway Hospital, where they had a Century 2 unit, and with one patient, one machine, we picked up from there and went on. Around that time, Malankara Medical Mission Hospital, she mentioned, in Kolancheri, which belongs to my church. The bishop had also said, you come around there because Dr. Maman has left, some senior doctors had left, and it's in a bit of a crisis. So with permission from the Little Flower Hospital staff, I went there. And their neurosurgical and psychiatric unit was doing very well. So they're getting some clientele, but the rest of it was not in a good position. So we have to boost the morale. One thing I did was, why not start a dialysis there also? We started Dr. Mariama and ex-student from here, and Dr. Reji, we started the dialysis unit there, mainly for snake bites, for others also, for other diseases also, until we could get a nephrologist who was willing to come to a small town to practice. Then, of course, the nephrologist took over. Till then, the medicine people took over. So that sort of gave us something. And then thought, why not? In Vellore, you have sabbatical. You can go for 1 or 2 years, isn't it? So he said, why not try that, some of the staff there. But we modified it because we can't afford to send somebody for 2 years with the small staff strength. Why not go outside for 1 or 2 months? That's what Jeslock Hospital does in Bombay. And the hospital will support their travels, but they'll have to find, or we'll have to find someone who can look after them, their friends or classmates or things like that, and be exposed to something new. So there was one person who went to, Dr. Sojan, who went to US. He went to different hospitals, and he's a nice chap. He studying theatre, how theatre is designed and managed, and how the hospital is managed. And that came in very handy when our hospital became a medical college a few years later. There was Dr. Mariama, who went to Amsterdam studying on leptospirosis. In Amsterdam, there's something very funny. It's not every bacteriologist, it's the physician who is interested in that particular process of bacteria, and he comes as a bacteriologist there and works in the lab. While I was in Little Flower Hospital, there was somebody who came with who had seen with jaundice but severe muscle pain. At that time, we had no idea, but I said this could be a leptospirosis, and gave him shots of penicillin, and she improved very dramatically. And her husband came and said, "Sir, how does this person get the disease?" And she said, rats urine, but my wife doesn't go out of the house. Next day, the patient told me, my husband shot our Alsatian dog, but dead. He said, what happened? He had thought of this. How did the rat urine come to my wife's leg? You'll have to excuse me. She, for going all the functions, she didn't like hair in the legs, so he used a razor. And their Alsatian dog runs all around the countryside, and they show affection by. So licking on the shaven leg wasn't the way of entry. But I think all medicine people should do a little bit of business management where you can find out how and why the disease or the bacteria reached that particular space. Like the Japanese who came to me in Little Flower Hospital, I got a phone call from Madras from an Anglo-Indian couple. Could I come and spend a few days in your hospital to see the hospital, especially the lab? I said, why the lab? I am part of the British Leptospira research meet in Barbados in West Indies. I've come to India to look up, to trace my ancestry, Anglo-Indians. And so they came there. He stayed in my house for 3 weeks, and we set up the rough starting for saprophyte bacteria being grows, which could be used as an antigen for crude testing for Leptospira. And he introduced us to Amsterdam Leptospira Research Lab, and we were in contact. And the next year, they had the meeting of the Leptospira International Convention in Ernakulam. And the people from Amsterdam stayed in our place, developed our lab, started helping us with culturing organisms, and we were the first to culture human Leptospira. The organism was called Australis, and the sub is Bharati, a new strain. That's the first time in India. Before that, there was one in India, but that was not in mainland India, but is in the Andaman Nicobar Islands, where the research lab is situated. Around the time the WHO team had some function in Ernakulam and made way to the WHO chiefs and said, would you please come to our hospital? We can show you some Leptospira cases. He made time to come to the hospital, see the cases and see the lab facilities. And he said, we are way up in our protocol for helping people, helping Leptospira work. He said, we are working. If you can help us, it would be great. He said, why don't you put an application? We'll help you. Right now, straight away. I thought that's simple. Write an application, give it to him. And then I found you can't write to the WHO. You'll have to go through the ICMR. So went to the ICMR. You know what they said? ICMR has got no objections to WHO helping Malankara Medical Mission, provided the funds come from allotted to some other country which is not used, not what's allotted to India. So I took that letter to this particular WHO chief. He gave a big grin. You go back, man. Next week the check would be there. And sure enough, we could buy a microscope for looking at the dark field microscope and a computer, which you could only dream of. We didn't have money at the time. And some money for doing some development and doing the research. And in the next meeting of the leptospira group, by the time it had become a medical college, and one of the professors said, I have presented in many national issues. I'd like to have one presentation in the international group. Sir, നമ്മുടെ group തന്നെ ഉണ്ട് in Ernakulam. So he came in, he was so happy that he went on to it. So just one case, which is people around there eat a lizard. It's called udumba. It's and that one has produced parasites in the gallbladder. If you can eat the gallbladder raw, even share it to two or three friends. It's very good. It's a very good aphrodisiac. It's a very good one to increase the resistance against the units. So there's one fellow who ate it and he came back with severe headache, meningitis. Eosinophils is high, proteins is high, nothing else. I asked a neurophysician at that time, said treat it as tuberculosis without any evidence. But about 2 months treatment, the other fellow who had taken, shared with him, he came back. He had used some Ayurvedic medicines for his headache. He had improved. Same thing has cost him. It so happened, the other unit also got another 3 people who had shared a similar thing. And we got, luckily got a dead, that particular lizard, dissected out. We managed to open up into the gallbladder to find something, binary fission occurring. Just you look up, binary fission on the low power. Some parasite dividing away. Didn't know whom to show it to. There was somebody who said in Assam, someone, we sent the slides to him. Unfortunately, either it didn't reach him or he didn't bother to reply to it. We still don't know what. But a similar thing has occurred also in the Philippines, I'm told. When it became a medical college, I was asked to speak to the students from the preventive medicine group. They tell stories. So I would go around there, tell stories of my time in Madras Medical and Christian Medical College, and try and tell them stories which would challenge them, which would make them think of what they are entering to in medicine. What I was taught in here in Vellore, to minister and not to be ministered unto, so that some of that will just stick on. Some of the students there did research, and the student research wing, they have some meeting there, and they went to a number of them, got a number of prizes, and very happy with what they did. And thank God that he has helped me in 2 hospitals, again, one becoming a medical college, trying to share what I was taught here. Not just address what one person said, but also what I learned here, to minister and not to be ministered unto. Thank you.
So I think you can clap again, is all I have to say. Thank you so much, sir. And if I could play your message again and again, it will just tell us why we all choose medicine. I think you just, just put it all into a capsule, balancing the why and the what. Why has the patient come with this? What can we do about it? The finances, being a detective, down to the lizard's gallbladder. I don't know how you dissected that, but among many other things, and then constantly reinventing and making the world a better place for patients with disease, anybody who's unwell. So I think, sir, thank you so much. And I think it's truly an honor to actually give you the award. It will be presented to in college on College Day. And this was more for honoring him from the behalf of the department. We do have a process by which we have a lot of nominations, and then we decide on who, and this has been going year by year, as Namrata mentioned. Just before we open for questions from the audience, I'd just like to invite Dr. Madhuri is joining us online, the daughter of Dr. Mary Kane. Dr. Madhuri, I can see you're online. Would you like to add any comments, please?
Can you hear me now?
Yes, ma'am, we can hear you.
Okay. Thank you so much. I'm really honored that Dr. Epen has received this honor on behalf of my mother, and I speak to all of you on behalf of that. It's really, Vellore has always stood up to all the ideals that we come with, stars in our eyes and dreams in our hearts. But it has stood up to these high morals, gone on to becoming the most premier institution in our country. And none would be more proud than my mother. And year after year, the team at Vellore has chosen the best possible candidate. And that really encourages my family. And seeing a person like Dr. Epen receiving it, it's an honor, it's a privilege. I congratulate Dr. Epen and I congratulate the Department of Medicine. I've already extended my thanks to Dr. Anand, and I would also like to thank Dr. Sam, but I think today he's not here, and hope to see you someday at the awards. Thank you so much, Doctor.
Thank you, Dr. Madhuri, and we are grateful to your family for setting up this award because it helps us also recognize alumni who have made an impact and also inspires us to greater heights. Thank you, ma'am. I'll just, Dr. Samuel, please go ahead, sir.
Thank you so much. It's my honor to really thank Dr. C.K. Epen to come. I'm so sorry I could not be there. I had a wonderful conversations. One common thing that I see is that I also saw my first snake bite in Nepal. And for the next 6 years I was there. We did publish an article which the editorial in Tropical Journal and Tropical Doctor, and Dr. D.A. Wall was the editorial for that. So listening to you has been a wonderful pleasure to see all the things that you did there. I'm sure those days we had to do a lot of innovations. These days you have ready-made things, you take it and throw it. But I'm sure this would have been a big inspiration for all our students and all our faculty. So thank you, sir, once again for being here, sharing your thoughts. And we wish all the best as you receive and especially on the
Thank you, sir. Sorry, you just.
Thank you once again.
I think that was thank you said in many ways. Thank you, sir. Anybody in the audience would like to ask a few questions? I think everything that sir shared with us is very real time. I think as sir you were speaking, a lot of us were nodding about our own experiences, even to this day, if you look at snake bite and leptospirosis and other diseases. Any questions from the audience? Any comments? Anybody online also can please just join us if there's anything you'd like to ask, sir.
Yeah, I would like to share a few of my experiences here in Nasik. I work as a professor of medicine at the Government Medical College in Nasik. And our hospital being a tertiary referral center for snake bite cases, we have around the Sahyadris, we have a lot of rainfall. So we get people coming in from really rural areas, like Dr. Epen mentioned, and we do see these challenges, but thankfully we have a lot of anti-snake venom available to us, and we do these cycles of neostigmine, and I'm really happy to say that we've had almost a 0% record of mortality, some morbidity, and I think Dr. Epen's lecture will make me more aware about hypopituitarism, which I will consider next time I see a patient not responding so well. So I thank Dr. Epen for giving us some light into that, and it will really help me and my residents next time we encounter these patients. Thank you.
Thank you, ma'am. I think life of a physician is forever learning. I think we're lifelong learners and there's never too late, something new to do for our patients. Thank you, ma'am. Amit, please, you may have to come in front. One of our consultants will lead.
Sir, thank you so much for your talk and inspiring us all about your life. Sir, just one question. The hospital that you first worked in, that is the Tilfa Hospital, later went on to describe, I think, the first instance of hum nose pick viper in India. So I'm not sure if you were still there when this was described, but if it was not, then were you seeing patients who are not responding to antivenom, and were you also really thinking that this could be another viper species other than the saw-scale viper or Russell's viper that is causing this?
Pump-nosed pit viper, we don't have any antivenom for it. It's found in different places in Kerala. We find it in Pondicherry also. And actually, I went to Little Flower Hospital last week and asked, because we don't have any antivenom, and looks like the government is not interested in producing antivenom for a new snake because they got so many other things on their mind. And so I just put an idea into their head. Why not use a patient who's been bitten by a hook-nosed pit viper, use the plasma for the patient? Nobody knows. One story was, I don't know whether a patient in West Indies years back, true or false, I don't know. They said was bitten by a snake, cobra, paralysis. There was no ventilator there, ambu bag, different people. The family members went on doing it for 3 weeks. Patient recovered. True fact, I don't know. But by 3 weeks, the body produces its own antibodies. So the hook-nosed pit viper, those patients must be having some antivenom. If we can use their plasma, maybe a year from now, Little Flower might give us the answer, because I asked them the same thing. Thank you.
Thank you, sir. And Amit is actually in Medicine 1. They look after toxicology and they do have a hotline to serve the patients who can call at any time of the day with any kind of toxin-induced disease. And the interest comes from there. I suppose if you catch a couple of mongoose from that area and check them out, I mean, learning from you instantly. And pythons, what they bite, and find out, you know, how things, other animals survive with those snakes, maybe. I mean, this intellectual curiosity that you put into my head for today. Any other comments, anything to add on? Because I think Sir's journey has been constant reinvention and learning as you saw a problem. It's not something that you can predict what you will see before you get it there. And that also constantly means you're in touch with your patients and questioning why they are sick. Sir was also watching the clock, so even I'm watching the clock, so keeping the time. Is there anybody else online who would like to share any comments or thoughts? Dr. Anand? Sorry. Sir, Dr. O.C. Abraham. So, sir has been our leader of intellectual curiosity here as our teacher. Dr. Anand, would you like to add on anything? So, I would like to invite Namrata to give us the vote of thanks. And I'm sure she'll be available after this if somebody would like to ask questions, but not in a public forum. Namrata, please.
On behalf of the Department of Medicine, I have the honor of proposing today's vote of thanks at the end of this inspiring session. First and foremost, our heartfelt thanks to Dr. C.K. Eapen, this year's Dr. Mary Kane awardee, for delivering such a thoughtful and endearing. Your words have reflected the values that this award stands for, sir. Thank you for sharing your wisdom in your journey with all of us today. You shared many anecdotes, each of them started with a question, but the grit and persistence that it required to find those answers is well appreciated. We especially thank Dr. Mary's family for their enduring association with the department and for preserving her memory and values so that she deeply embodied. I would also like to thank our senior faculty for gracing this occasion and for your continued guidance and support in the department. Our gratitude extends to the audiovisual and telecommunication staff and everyone who worked behind the scenes today to make today's event a success. And finally, a warm thank you to all our faculty and residents for your enthusiastic participation and presence. Please join us for coffee and refreshments outside the hall after this session. Thank you once again.